Depth of improved Newbar counting chamber is option A 1 cm, option B 0.1 cm, option C 0.01 cm, option D 1 mm. And the answer is option C 0.01 cm. Best counting chamber used for CSF cell count is option A Fudge-Rosenthal chamber, option B Newbar chamber, option C Burkitt's chamber, option D improved Newbar chamber. And the answer is option A Fudge-Rosenthal chamber. In iron deficiency anemia, MCV is option A increased, option B decreased, option C slightly increased, option D no change. And the answer is option B decreased. The term Punjab HB refers to option A HBA, option B HBF, option C HBD, option D HBE. And the answer is option C HBD. pH of the buffer used for Romansky staining technique is option A 8.6, option B 6.0, option C 6.8, option D 9. And the answer is option C 6.8. The suitable dilution for RBC count is option A 1 by 10, option B 1 by 1000, option C 1 by 200, option D 1 by 2000. And the answer is option C 1 by 200. Normal thickness of buffy coat after centrifugation for PCV. Option A 10 mm, option B 100 mm, option C 0.1 mm, option D 1 mm. And the answer is option D 1 mm. The cellular components of buffy coat are option A RBC and platelets, option B platelets and WBC, option C RBC and WBC, option D neutrophils and RBC. And the answer is option B platelet and WBC. In multiple myeloma, option A ESR is increased, option B plasma cells are increased, option C Rulex formation is increased, option D all of the above. And the answer is option D all of the above. In improved Newbar, the total of tiny squares in the center RBC area. Option A 5, option B 25, option C 400, option D 16. And the answer is option C 400. The total number of squares in the WBC counting area of an improved Newbar counting chamber is option A 16, option B 4, option C 64, option D 25. And the answer is option C 64. The total WBC count of a patient suffering from pyogenic infection is option A 2000 to 5000 WBC per cubic mm, option B 5000 to 10,000 WBC per cubic mm, option C above 1 lakh WBC per cubic mm, option D 15,000 to 20,000 WBCs per cubic mm. And the answer is option D 15,000 to 20,000 WBCs per cubic mm. The normal WBC count is option A 7 plus or minus 3.0 into 10 raised to 9 per liter, option B 10 raised to 11 per liter, option C 3 into 10 raised to 9 per liter, option D 5 plus or minus 3 into 10 raised to 6 per liter. And the answer is option A 7 plus or minus 3.0 into 10 raised to 9 liter. The diluting fluid used for platelet count must be stored in the refrigerator because option A the diluting fluid is unstable at room temperature, option B the reagent is photosensitive, option C both A and B, option D to prevent bacterial growth. And the answer is option D to prevent bacterial growth. The smallest cellular component of peripheral blood is option A megakaryocyte, option B monocyte, option C platelets, option D microcyte. And the answer is option C platelets.